Hello, everyone. Have a happy Saturday today. I'm sure it's an R&R day. So we had a lot of interest in questions online, and with regards to questions by other listeners as to why some of the legal issues around medical marijuana still exist and what's the overall uh, concerns with regards to it being a scheduled agent. Well, let's talk about what is a scheduled agent as per the federal government's Drug Enforcement Agency. So the federal government's Drug Enforcement Agency classifies scheduled agents into various classes: Schedule 1, Schedule 2, Schedule 3, Schedule 4, and so on and so forth to Schedule 5. To give you some examples, Schedule 5 are agents that can cause some side effects like sleepiness, confusion, therefore are scheduled as Schedule 5 and cannot be sampled to doctors' offices and need to be prescribed. These are simple agents like Lyrica, Robitussin with codeine, a a anti-nausea medicine called Lomotil, etc. Schedule 4 is a little bit more stronger medications. These are things like Xanax, Darvocet, Ambien, and Tramadol. They can also cause confusion, have a very low abuse potential, and are low risk dependence. These are in the low level. With regards to Schedule 3, which is a little bit stronger, these are medications like Tylenol with codeine and anabolic steroids, which have slightly higher abuse potential, can be addictive, and can cause psychological dependence. Schedule 2 agents are even more stronger and are things like oxycodone, morphine, and fentanyl patch and Ritalin. These are definitely at risk for physical and psychological dependence. They need to be monitored carefully. Patients need to make sure that they get routine kidney function tests, urine function tests, and liver function tests, and need to be counseled on the addiction properties of the same. It can also be mind and mood altering. Now, the highest ranking agents are Schedule 1, and that is marijuana is in that ranking. Heroin is in the same ranking. LSD is in the same ranking. But we have now realized that marijuana, to a certain extent, may be placed into that ranking without a full understanding of or clarification of what actually marijuana does and why should it be in the Schedule 1 ranking. Medical marijuana has little to no THC in it. So the risks of it causing psychosocial and physical dependence and mind and mood alteration is very small to nil. Therefore, medical grade marijuana, which is primarily full of CBD oil and very little THC, or no THC of any significant amount, should potentially not be in that same category as Schedule 1. It may very well drop down to something in the Schedule 5 range, which is a minimal of an event. That being said, the regular grade street level marijuana is still in the Schedule 1 agent, primarily because of its physical and psychosocial dependency, mood and mind alteration, plus its political stigma it has in the past from history of usage by many people who have behaved in an inebriation fashion. That is the reason why medical marijuana has been clubbed in with all marijuanas to be labeled as Schedule 1. If the Drug Enforcement Agency of the United States were to take a closer look at medical marijuana, they would probably consider demarcating out the medical marijuana out of the scheduling and be more specific with regards to what they mean by marijuana being a Schedule 1 agent. Marijuana by itself, of course, what people use as socially available or street level marijuana is a Schedule 1 agent, can have psychological dependence, physical dependence, and can be mind and mood altering. But the medical marijuana does not have the same properties. It is mainly an agent that is full of CBD, almost no THC, and it helps improve symptoms that are related to brain injury, nerve injury, fatigue, and several neurological diagnoses, and even several diagnoses such as epilepsy, for which they are now formally approved. We in New York State are allowed to prescribe medical marijuana for various indications. Unfortunately, the federal government still has not approved the same. They have been so far looking the other way when various states have enacted the use of medical marijuana. This has created some concern in the medical marijuana industry because whenever the political winds in Washington change, that can create problems for each state as far as oversight by the Drug Enforcement Agency, which is a federal authority. So with that, I will close the discussion of the scheduling of the agents. But with that, I also want to bring to the forefront some interesting global issues that we've noted. In countries where Islamic law is prevalent, any agent that can cause mind and mood altering dependence and physical and social dependence, it can cause an issue with regards to being approved. In a country such as Malaysia, recently they sentenced a doctor to death who had medical grade marijuana, which is primarily CBD oil, for use of patients who had cancer-related side effects such as lack of appetite, nausea, vomiting, and neuropathic pain. And he would give this to them to improve their symptoms. And this resulted in the justice system there recently sentencing him to death pending an appeal. We are all shocked in the medical community about the same. And I believe many of the independent observers of the rule of law in Malaysia are also shocked. Unfortunately, there's a underpinning of Islamic law that has been used in these countries to prosecute people who sell medical marijuana or medical grade marijuana, and that is why we're in a bind. So with that, let me pass the mic over to the audience as to what questions they may have.
In regards to medical marijuana in the United States, being it's on a per state basis, how does legality go in terms of transporting it when traveling?
Well, that when you travel with medical marijuana from one state to another state, it falls under the purview of the federal government. And unfortunately, the federal government deems it illegal. If you are caught transporting it, say on a plane or on a car going on an interstate highway, for various reasons, I'm assuming common sense will prevail. And if it's something that it's a small amount just for your personal use, for your medical diagnosis, you have a doctor's letter why you were prescribed it, and you have a prescription given to you from a state where you were certified in obtaining medical marijuana and you have a state permit, I'm sure, and I'm pretty confident that whoever stops you will probably ultimately not prosecute you for that issue. However, if you're transporting gallons of the medical marijuana from one state to another state by car or any other reason for a commercial reason, so you're manufacturing it, let's say for hypothetical reasons in Connecticut, and you're bringing it to New York in an interstate travel situation, and a federal trooper, not a state trooper, but a federal trooper finds an issue with your driving skills and stops you, now he has not only stopped you for some issues related to driving, but has found gallons of medical marijuana in your trunk in a liquid form, they will probably prosecute you for the full extent of the law, and that can be severe. It can be several years in prison, because the federal government, unfortunately, still looks at medical marijuana the same way as routine street level marijuana. I hope that answered your question.
Do you foresee within this next year federal proceedings or federal views on medical marijuana or marijuana in general to change?
Well, medical marijuana views across the country have changed. I perceive that the federal government will continue to look the other way because it costs too much to prosecute and it costs too much to track down now that the majority of the states in the United States approve medical marijuana. That being said, will the current administration completely legalize the use of medical marijuana across all states in the United States? I don't believe that will happen because the current administration and its attorney general have been very clear in their public statements that that is something that they will not probably pursue. They will probably continue to prosecute the transportation and manufacturing of large-scale medical marijuana across state borders as a federal crime. I think they will also continue to restrict banking privileges to those businesses that specialize in collecting money in the medical marijuana space and dispensary space. I think given all of those issues, the current federal government and its administration will probably not be sympathetic to the industry. The only thing that the industry could probably expect from them is for them not to actively go and pursue users of medical marijuana, but rather those who are egregiously breaking the law by transporting gallons and the gallons of items across state lines.
Can you identify any particular reason for the current administration's hesitation in regards to marijuana, especially being that there is more and more medical documentation coming out supporting it by the day, and the fact that all the states that have legalized it have amassed massive tax incomes?
Yes, I think your idea is the best, that they should legalize it because there's massive tax incomes and regulate it in a legitimate fashion. But the current administration seems to have some level of information lack or lack thereof of accurate information. They're clubbing the use of medical marijuana in the same boat as street level recreational marijuana because they don't seem to want to understand. Maybe they do understand, but they don't seem to want to understand the differentiation between medical marijuana and street level recreational marijuana, which clearly does, the street level recreational marijuana clearly does cause some level of mood and mind alteration, some level of psychosocial dependence, and some level of physical dependence. Whereas the medical marijuana is not the same. It does not cause the mood and mind alteration. It does not really cause dependence, but rather improvement of underlying symptoms. And that's why we need to be a little careful with the current administration because of their lack of fund of knowledge or their lack of interest in learning more about the space.
Being the government's apprehension in approving marijuana, why was the drug Epidiolex approved, being all it is a synthetic form of an existing plant?
Well, Epidiolex was approved as a compassionate use protocol. In our federal drug programs, and in our in every country across the globe has a program called compassionate use. If there is no other agent available to treat a particular condition, then if a certain agent is found to treat a particular condition, the compassionate use program allows you to get approval for that agent under that program. Epidiolex was specifically approved for a catastrophic form of childhood epilepsy called Dravet syndrome. And this is a epilepsy that can cause dozens of seizures in a day for a child, if not more. And that results in the child becoming mentally challenged, physically challenged, and having a very unhappy childhood. And parents are in a much worse situation and are unable to manage the situation. What was found by accident is that the agent called Epidiolex worked on these kids. It worked on these kids, reduced the seizures frequency, in some cases almost to 90+%, and made them have better and closer to normal lifestyles. And that was really a compassionate use protocol, for which reason Epidiolex was approved for that particular diagnosis.
How do you feel about the near approval of MDMA for use in PTSD/depression? Meanwhile, marijuana is facing opposition even for things such as pain.
Well, the use of marijuana will always face opposition until the federal government reclassifies medical marijuana as a level 5 scheduled agent and leaves recreational marijuana as a level 1 agent. That'll continue to be there. Whereas agents such as the ones that you mentioned for PTSD have been approved for use for PTSD with regards to a very specific diagnosis, and especially in the context of veterans administrations. That is why it got an approval. If it was being approved for the general population, like any other drug would be approved for, then we would not see that fast a process occur.
To your knowledge, does the VA system at all support marijuana?
The VA system under the past administration was looking at medical marijuana as a treatment alternative for various diagnoses that they're dealing with. Unfortunately, the current administration has not been so interested in pursuing that route. It is unclear as to why, but that seems to be the tendency. And we're hoping that the lobbying companies that work with the federal government educates the federal government regulators as to what actually medical marijuana is in comparison to street-level marijuana.
Have you personally noted any negative side effects from usage of medical marijuana in your patient base?
There's only some side effects that are, all side effects are negative, unfortunately, but there are some side effects that are subtle and need to be watched out for. In young women, hormonal side effects. These can lead to abnormalities with regards to ovulation, their monthly cycles, and women can also have difficulties with pregnancies, where they can have unwanted pregnancies if they're on oral contraceptives. In men, hormonal cycle changes can be caused also. With regards to general systemic side effects in the case of using medical marijuana with hepatic and liver problems and kidney problems, it is not something that we see because it's a natural element, and it's not something that has been identified. There will be some side effects that are reported with regards to the compounds that are used to create the oil. Those are unrelated to the active agent that is medical marijuana, and I think that is easily manageable if it does occur. But overall, the catastrophic side effects, which is what we're all worried about, is almost nil. We'll do one more and call it a weekend.
How often are you seeing patients transition from large amounts of pain medicines to a lower dosage with supplementation of medical marijuana?
Well, that's actually a very good question. We're seeing that more and more. And the reason we're seeing that more and more is because now most federal government authorities and state government authorities want us to keep a morphine equivalency dose of 90 or less. So if you're taking oxycodone or anything that's in the opioids family, and the total amount of daily dose that you're taking is scored at a morphine equivalent dose of 90 or more, which you can calculate from an online calculator. So for instance, if you're taking 10 milligrams of oxycodone, it's a 15 milligram of morphine equivalency. You're allowed 90 a day. Above that, the risk of shortness of breath, breathing difficulties, and other complications are higher. So we try to keep the morphine equivalency dose of the opioid and pain medications of 90 or less. And we try to actually bring it down to a minimum dose. That being said, we've used and utilized medical marijuana as a supplement to bring those dosings down. And we've been fairly successful in many, many cases over the last 1.5, 2 years. So with that, I will close for the weekend. And next week, we'll have a few more interesting topics. If you have any comments, please post. We'll answer. And otherwise, have a nice weekend, everybody.